So the process of radiation planning begins with a radiotherapy consult, after which you are given an appointment for something that is called radiation planning. Because radiation is something that once delivered to a patient cannot be taken back. There is no antidote to overdose or wrong treatment with radiation therapy, and therefore any radiation therapy service or treating team is very cautious and have a number of checks in place so that what we intend to do is actually what is being done to you. So in the radiation therapy planning process, you will be asked to follow a set of instructions by radiographers who are special engineers or trained technicians to operate a few machines. You will be taken into, you will first report to a radiation waiting area, and then you will be called into a machine room which has a lot of safety equipment that monitors the patient inside and out, and it is a very simple CT scan machine. Most of the radiotherapy planning appointments are painless. We often make some devices called the immobilization devices so that there is no movement on the actual treatment machine when you receive radiotherapy, so that radiation is actually delivered where it is supposed to be delivered. On the planning day, depending on where you would receive radiotherapy, our radiographer team or any radiographer team would be positioning you in particular positions. Say often somebody will tell you, well, ma'am, hold your breath and count 3, but people will be training you. So there is no need to be, fearful of the appointment. Often staff will give you a set of instructions before the actual procedure. And like I said, that depending upon the site that we would intend to treat, you will get crisp instructions from your treating team. Once you are positioned with your immobilization devices, there could be a need to inject contrast. Again, we would be eliciting whether you have previous allergy to these contrasts. If so, we will not use contrast. If not, in most situations, we will be using contrast to see where exactly we wish to focus radiation therapy beams to cure your lymphoma. The entire process after injecting contrast to acquisition of something that we call the radiation therapy planning scan takes about 7 to 10 minutes. Although we request for an appointment time of an hour so that you are mentally prepared for some delay, if any, from our services. Once the radiation therapy planning scans are acquired, while you are on the couch, our radiographers will be checking whether all images are correct and exporting those images into, electronically of course, into something that's called the radiation therapy planning system. Only after image evaluation and checks are complete would you be given the freedom to go home and do something that you would want to do to relax for the day. You will be leaving the Department of Radiation Oncology with an appointment to report for your treatment. There is a gap between the radiation therapy planning and initiation of treatment, and that gap varies anywhere from, say, 2 to 3 days to about a week. And for emergency treatments, of course, it's done on the same day. Now, you would want to know what do doctors and engineers do during this gap. So during this gap, we work on your images because you are represented by your images in the Department of Radiation Oncology. Our machines recognize you as images, and on those images, it is the responsibility of the treating radiation oncologist to delineate for our treatment planning computers which area is the tumor-bearing area, which is the area that harbored disease before chemotherapy, which is the area that is currently of concern, and of course, the most important sections will be to delineate for our computers, which would compute radiation doses, your normal tissues. Because the goal for any radiation oncologist or treating team is first, we do no harm with radiation therapy. That takes us about 3 to 5 days of processing time, and that after a doctor finishes contouring, our physics engineers take over. They trigger the computing systems in such a manner so that safe radiation therapy is planned. This takes about 2 to 3 days, after which we do a lot of hardware checks and engineering checks on our machines. We test your plans on phantoms to see that you would exactly receive what we intend to give you. And when you report for your first radiotherapy fraction or treatment, we would just come, we would request you to come in, mentally relaxed, because everything is safe for you. And we would also encourage you to, concentrate on non-disease thoughts, and that would help you recover and sail through radiation therapy with help of doctors, our supporting staff, our engineers, who are ready to take care of your needs at any point in time during and after treatment.
During my radiation, I had no problem at all. I used to come early in the morning. 20 radiation is 5 days a week. Saturday, Sunday was off. I used to be the first patient, go for the radiation and go straight to work from the radiation room. Go to the hotel, change and start my work. So, and it's a 10 minutes process and it's absolutely painless.